Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Rachel Kowalsky and Shari Platt. They are pediatric emergency physicians, and together with Mary Birmingham, they co-wrote the Kevin MD article, Dying of Loneliness, the COVID-19 Epidemic in Children and Adolescents. Rachel and Shari, welcome to the show.
Hi, thanks for having us.
So before we get into the article, I'm going to ask each of you to share your story and journey to where you are today, and maybe one thing that surprised you over the past 1+ year of the pandemic. Rachel, why don't you go first?
Sure. I'm Rachel Kowalsky. I'm a pediatric ER physician at Weill Cornell Medicine. I've been there about 10 years. And one thing that really surprised me during the pandemic was the way in which people came together inside of the hospital, kind of came out of their silos and worked together in settings they were completely not used to working in. We had all different types of surgeons and subspecialists come down to the ER to work alongside us. We shared space with other groups and just saw some amazing flexibility and teamwork.
And Rachel, that is one of the themes that I've heard many physicians say about how everyone who previously was siloed came together really, really well during the pandemic. And what are some examples sometimes of the clinicians and the administrators in your institution coming together during the most dire times?
We really developed our telehealth program. We already had a telehealth program, but we really enhanced it during that time and built it up. And together with psychiatrists, ENTs, colorectal surgeons, and just people who were out because they themselves had COVID but weren't as sick. Mm-hmm. We all staffed the telemedicine phone calls. And so we kind of were on a text chain together, and we would ask each other questions and kind of support each other and check in with each other. And it was just so interesting. I met dermatologists and people I really don't typically work with in the emergency room just through doing telehealth with them.
And Shari, can you just briefly share your story and journey to where you are today and one thing that surprised you during the pandemic?
Sure. So I've been at New York Presbyterian, Weill Cornell Medicine since 2001 and have gone through many disasters, but nothing even close to what we've just been going through with the pandemic. It was something that surprised me. I agree with Rachel, was the teamwork and the camaraderie. And I want to add something to the telemedicine story, is that the pediatricians were seeing patients of all ages. Mm-hmm. So our oldest patient was 93 years old, which was a lot of fun and very interesting, but really everybody of all specialists came together to work for a unified goal. So I agree with that. I think what was the hardest part for us was the effect of the pandemic on children. Mm-hmm. So initially we were incredibly relieved because, as everybody knows, initially the pandemic, the COVID-19 did not affect children in the direct way that it was affecting adults. As you know, then eventually they did develop the MIS-C, or multi-system inflammatory syndrome. And but at first it was really hard to be a pediatrician because we wanted to help, but we felt a little bit lost. And there were no children coming into the ER, and there was definitely a sense of loss of our subspecialty and of our skill set. And I think we felt a little bit floating, like we wanted to be helping, but we didn't exactly know how. It was definitely mixed emotions, but of course, in tremendous relief that children were essentially spared initially, which leads us to the article, of course, but certainly there was a lot of conflicting sense of emotions at the beginning.
And Shari, tell me what the picture is now. We're speaking in middle of June. What's the snapshot of the pediatric ER now?
So overall across the country, our numbers, our total volume in pediatrics has dropped, but we're coming back. The number of children that we're seeing now is rising. And as social distancing and social isolation changes, I think that, we, for a very long time, we were not seeing respiratory illnesses. We were not seeing injuries. Children were not in playgrounds, and they were not having head trauma, and all the very common things that we, our bread and butter in emergency medicine, was not coming into the emergency department. So now I think as our, and last night New York City came back open, which is very exciting. I think as our country and as our communities open up, our field will revive, and we're grateful for that.
Now, both of you are co-authors, along with Mary Birmingham, of this Kevin MD article, Dying of Loneliness, the COVID-19 Epidemic in Children and Adolescents. Rachel, for those who didn't get a chance to read that article, can you just walk my audience through it and share the story of how the three of you came together to co-write it?
So Dr. Platt and Dr. Birmingham and I were working a shift together in the ER. And this was in the fall of 2020, just before Thanksgiving. And there had been over the summer a little bit of relief from COVID, because people were able to get outside and see one another outside and just get some exposure to sunlight, and rates went down a little bit. But in the fall, there was this sense of dread that a second wave was coming, and the weather was getting colder and people were stuck inside more and more. And so that's sort of the context for it. And in this one particular shift, we just saw a lot of cases that were related to mental health and behavioral health, kids that were really struggling. And we kept meeting back. We would go out to see a patient and then come back into the room where we all work. And we would sort of look at each other and say, like, this is really different and this is significant. This is a problem. We're seeing a lot of children and adolescents who are in distress. And we felt like we needed to talk about it. The first thing that one can do, I think, if you want to change something, is to name it and describe it. And so that was sort of what we set out to do here. We described what that shift was like. We gave examples of some of the types of patients that we saw, and we talked about what it was like to see them right in front of us, as opposed to having seen data about the increasing rates of mental health emergencies. The children were right there in front of us, and so it felt very immediate and very striking. So we wrote about them, and we wrote about what seemed to be happening, that these children and teens were really disconnected from everything that mattered to them, from their schools, their social groups, their friends, their extended families. And they were also disconnected at the same time from the same mental health services that might have been able to support them, because a lot of children became unable to access those supports as school went away, and in-person medicine in large part went away. So we described that, and we talked about our hopes for the future, specifically about how important it would be to get children back in school, and also about just shining the spotlight on children, turning to look at them and notice what it is that they're going through. Because, of course, we were so focused on all the adults that were in respiratory distress and severe cardiorespiratory problems from COVID. We just encouraged the readers to kind of turn back and look at children and make sure that we were thinking about them and supporting them.
And Rachel, without giving away too much identifying information, can you just paint us a picture of a sample case of some of these children that you would see in the emergency room?
Sure. So it runs the spectrum from just increased visits for psychosomatic complaints like some abdominal pain or headache, children sleeping more than they typically would or less than they typically would. But then the spectrum goes all the way to real suicide attempts, serious eating disorders, children cutting themselves. We saw a lot of children who were really suffering.
And Shari, so now that you have this influx of children under mental distress because of the pandemic, Tell us some of the questions you would ask them and some of the things that you would do next.
Yeah, so I think part of the point of the article is to humanize it, right? Because I agree, there are studies out there and there's a lot of data, but this is a real thing that families are going through, and children and their parents. It's really devastating, and it's not stopped. It is ongoing every day, and it's been talked about on national forums, that we are really in a serious mental health crisis for our teens and even our young teens. Like, we're seeing 8-year-olds who want to die. That's not okay. And that's not common. I mean, we were in a mental health crisis prior to COVID, but what we're seeing now is a fallout of a year plus of isolation. And we don't have experience with this. We don't know what this type of sense of loss of normalcy, how it's going to really affect our children and our future generations. So, opportunities to improve. Obviously, the very first thing, we can't have this without at least saying once, get vaccinated. For the children who are of eligible age and medical condition, we strongly urge the vaccine. It's safe, it's effective. And that is definitely the first step to really opening up the door to normalcy. Other things are to recognize it, to think about it, and to have those hard conversations. I think, a lot of people tend to think, oh, kids are just, they're resilient. They'll just get, they'll go outside, play, ball, and they'll be fine. And I worry about that, because I think that we as a society really need to think about it and to recognize it and to ask our kids, how are you doing? Ask like open-ended questions, like, this has been hard, like, how are you feeling? And it might not be a conversation for the dinner table. It might be a time where, kids feel they open up. Your kids, like, when they open up, it might be late at night or a car ride or some time where they're really like feeling safe and want to open up, and for providers to include that as part of their screening process. Everything is different now, so I think it's really important to ask kids about. I've had kids who have not seen a friend in months. They don't leave their room. They're on Xbox. They're on social media, which has its own story to tell. So I ask these questions all the time now in the ER. I'm always asking them, what's school like? How are they feeling? Are they seeing their friends? Did they miss graduation? There are so many kids that I think that we need to just think about it.
And Shari, when you ask these open-ended questions to these kids in the emergency department setting, what are some red flags that you're looking for? And if you find these red flags, what kind of resources do you offer them?
Great question. Red flags are kids who maybe don't express it or are not as willing to open up. Some of them sound really confident. They say, I'm fine, I'm seeing my friends, I'm doing things. But you can sort of tell when kids are not able to really express themselves. And then there are definitely kids who come in who tell us that they want to die, or that they can't do this anymore, like it's too hard. And we need to think about that and take it seriously. Obviously, resources is a hard one. They are definitely we have children waiting for days in the ER for inpatient hospital beds. There are definitely less psychotherapeutic outpatient resources than we've had before, and many of them are virtual. And so it's a matter of, reaching out to our psychiatry and psychology and social work colleagues and trying to develop relationships and partnerships so that we can provide outpatient support for the children. And then I think school is a really big thing. I hope the schools are listening and take it seriously and recognize that kids who are dropping off their academics, kids who were previously doing really well and now are just not submitting assignments, their grades are falling. We need to think about, instead of being punitive, we need to think about being supportive. And I think that's really important for the schools to recognize this.
We're talking to Rachel Kowalsky and Shari Platt. Both are pediatric emergency physicians, and together they co-wrote the Kevin MD article, Dying of Loneliness, the COVID-19 Epidemic in Children and Adolescents. Rachel, so we are slowly opening up, and I think that's very, very encouraging. And there are summer camps that are starting to open, and next year's school probably would be in person. So can you foresee the next 3 to 6 months for these children? And what are some things that we could do as parents to help them recover from this mental distress?
So I think it's great that summer camps are starting to reopen. I work as a doctor at my son's summer camp, and I can see how happy he and his friends are when they can be together outdoors. And so I think over the next 3 to 6 months, we're going to see children starting to feel better. And I hope that that's the case as vaccination rates increase and as the warm weather comes, so that children who aren't vaccinated can still be together outdoors. I sincerely hope that schools will open fully in the autumn, because I think that's going to be really important as well for just returning children to routine, to normalcy, getting them reconnected to their peer groups, all of the psychosocial development that's supposed to be happening during these years, to get them back on the rails. But I think we can be cautiously optimistic.
So I'm going to ask both of you for your take-home messages to the Kevin MD audience, and maybe something that you've learned over the last year plus that you could apply going forward. So Shari, I'm going to start with you. What's your take-home message and something that you've learned over the pandemic that you can apply going forward?
Sure. So, with regard to children and mental health, I think our take-home message is to keep an eye open for it, to recognize it, acknowledge it, appreciate our kids, and keep an open line of dialogue so that children feel safe and supported and not invisible. I think that that's going to be the most important take-home message.
Good. And Rachel, what's your take-home message to the Kevin MD audience?
Well, I completely agree with what Shari said. Just making sure that we continue to really look at our children and really see them and check in with them, and that we continue to do so even as the world opens back up, even as we are able to vaccinate them, because we still don't really know how this lost year is going to play out as the years go by. One thing that I learned was just how resilient we are.
Mm-hmm.
It feels great to be slowly exiting this, year plus and seeing like, oh, we did that. And it kind of makes me think, okay, we're up to whatever comes our way.
Wonderful. Rachel and Shari, thank you so much for joining me and sharing your insight. And thanks again for being on the show.
Thank you so much for having us.
Thank you. Have a good day.